before we get into the episode, I just want to send a reminder to everybody. If you are needing support, please check out our free, absolutely free Facebook group. It is totally online. You can search it up, Getting Sober Group. I will leave a link in the description to that group. If you don't have a Facebook account, that's totally okay. We love you anyways. But if you need support or you want to support others and you want to be a part of an online community, we know it gets tough to pick up that phone, but maybe it's easier to post in that Facebook group. You need an anonymous post, you can do that. So check that Facebook group out. If you have any questions regarding what we're doing, if you have any inquiries or you need support privately, feel free to go to our website, gettingsoberyoung.com, and fill out the contact form. We love each and every one of you and appreciate all y'all support. Check out this episode. Jacob Umanzor, thank you for being on the pod today. I've known you for a couple of years now professionally. You've helped me a lot, and I appreciate that. But one thing I can say is you have stood out from the crowd. And I don't know if it's because everyone has so many like fantastic, I mean, I don't know if you know, but you're kind of like really admired in the community of mental health treatment. Like everyone that we talk about or talk about you too is like, oh, that guy's great. You know, even whenever this guy doesn't know you at all and he hears two really good stories about you, like immediately. So I appreciate your career path that you're on and what you're doing. Can you tell us immediately or in the beginning what exactly it is that you do?
Yeah, absolutely. Well, Tyler and John, thanks for having me today. I appreciate the kind words, man. You know, it's a really interesting experience to just like have a lot of passion for something, to love like doing this like really tough, like hard work, and then just having people like appreciate that, you know. So I never set out for it to be that way. I just I put my heart and soul into this work, and that's why I think it's a good fit for me, you know. So
right.
Yeah, what would I say exactly that I do? So I mean, I just give you like a very brief history of how I think I ended up in this work. So initially, like I wanted to just like help people. I just knew that that's like what I wanted to do. My mom was a nurse, you know, and I saw how fulfilling it was for her to like come home and tell me stories about like what she did at the hospital that day and how she helped somebody that maybe wasn't feeling the best. And so, you know, I didn't know if that's exactly what I wanted to do. Kind of explored that part of my life and maybe getting into the medical field. And then ultimately I just kind of landed on like, well, I just know I want to help. And so, you know, kind of finishing my undergraduate degree at Texas, you know, hook 'em horns.
Let's go.
You know, I figured out, well, like, I think I want to help. I really want to gravitate towards adolescents. You know, I know that, you know, I ended up at Phoenix House in that environment, but I knew I wanted to help kids, and really kids at risk is like kids on drugs. I just didn't know that at the time, you know? So I ended up getting my degree as a licensed clinician at from St. Edward's, you know, Masters of Arts in Counseling, and my internship was at Phoenix House.
Yeah.
So this is how I got into the field, you know?
That's cool.
Yeah, I didn't know, like,
you didn't know that. I didn't know.
I didn't know that I was going to fall in love with it, right? Like, I was just thinking, like, I want to work with adolescents, like, I want to help families. But getting into, like, the substance use, mental health side of helping people was just, I just saw, like, how incredible it is. You know, you watch people go from, like, the worst, most horrible places in their life and fight for their own lives. And you're just giving them guidance and support and like the right tools to get better. And so watching like young kids go through that, like really just kind of looped me in. And then my career path just sort of grew from there. You know, I spent some time at Phoenix House. I ended up transitioning. We were talking about the Arbor earlier, you know, here locally, they're a great program. You know, I was able to finish out my licensure there, get my full license as a clinician. I was IOP director there for about 2.5 years. And then Driftwood came calling, you know, and right now we're really trying to be like on the cutting edge of understanding like what is addiction, what is mental health, how does it overlap, and what are the best ways to try and help people, you know. So right now I'm the clinical director there. So basically I support the team, you know, with conceptualizations, you know, really stepping in on tough cases, like what can I do to support, you know, and manage that team. And then I you know, carry caseload, run some groups, and yeah, man, it's a busy schedule, you know, for me there, but it's amazing. You know, this is the best place that I've ever been in truly, really understanding, well, what is it that people are actually dealing with? I think it's super easy to get caught on like the behavior, you know, and I was actually listening to a couple of episodes before I got here today, and I love how you were talking about in one of your episodes of like the drugs are not the problem. It's the underlying stuff, right? It's like, what are the psychological factors that are feeding my addiction? And if we don't get there, like, how are we setting people up for success? So our program really focuses on like, well, let's take some curiosity into this. This field of substance use and substance use treatment, it's riddled with assumptions. Oh, you're an addict and alcoholic. Every time you open your mouth, you're dishonest. Well, maybe not. Maybe you're just in pain and you're just trying to figure out how to deal with it. Selfish and self-centered. Well, maybe the behavior looks selfish and self-centered, but is that person really selfish and self-centered? These are some of the sort of the cultural pieces that at times can give you an explanation, but maybe is only giving you like 2% of what's going on. What if we got curious and really tried to understand all of the factors of why somebody might engage in substance use? Then maybe, just maybe, it starts to carve out a path that gives somebody a better chance, and that's really kind of like the big overarching theme of what we're trying to do over there, so.
Yeah. Just make sure, I think the butt is facing you. Yeah, there you go. That's
right there?
perfect. Yep,
Okay.
yep. You don't want to face it away.
Yeah.
I am just curious.
Yeah.
Are you, or do you identify as a drug addict or an alcoholic?
No, I think everybody has their own path of recovery. We're all in recovery from something.
Yep.
Fortunately for me, if I look at this continuum, of like normal substance abuse, substance dependent, I probably fall somewhere between substance abuse and dependent. There was definitely a time in my life where my use escalated, and it was affecting me, and fortunately for me, I had this beautiful, amazing woman come into my life and say, you know what? I don't like the way you are when you drink sometimes. I don't like how you act. I don't like how you treat me, and, the things that you might say. And it was really kind of the first time where I think I was held accountable to that, where it was allowing me to like reflect on my own behavior. And it was like, well, am I going to change this, or am I just going to stay the same? And fortunately for me, I was able to make some changes. So I'm just pretty vigilant about what I put in my body, and how it affects me. And I really try to like be mindful of that. So but listen, I've done a lot of therapy, some trauma intensives, like I've put some significant work into like really trying to understand myself better, and be in recovery in certain pieces of my life for sure,
So what do you think the difference is with someone like you who can get the feedback, almost be given an ultimatum, and you can stop? Because if you look at it, right, like the rooms of recovery, it is one of the best free resources that somebody can have. But what's the difference between it from a professional standpoint and what you guys have found at Driftwood and what you already know anyways? What's the difference between someone like you who could be given an ultimatum and just stop versus somebody who may need extra assistance?
Yeah, I think there's several nuances to that, right? So if you look at what we understand about addiction now versus maybe what it was, 30 years ago, 40 years ago, is that this is a multifaceted issue. There could be many reasons why somebody would engage in substance dependence, Do I think that desire and a willingness or motivation to change is a great factor to have? Sure. But I also know that can't be the only one. Sometimes that motivation for change is just like a very skinny slice of the pie. Because you could be super motivated to get sober and not have the right tools and look like somebody that doesn't want to be sober.
Right.
And those words don't mean anything. And it's like, but does that person really want to change? A lot of times the answer is yes. So I think for me, like when you ask that question, what's the difference? There could be a lot of differences, right? Like I think about like biological factors like genetics, right? Like if you look at somebody's history and see the mental health and substance use in their family tree, like is that a huge component? We know that that's a component. But what about what they're dealing with in their mental health? What about the social cultural pieces, right? Like I grew up, I love to give this example to families, like Nombre Padre, Hijo, Espíritu Santo. I'm Catholic. Right, the first time I ever tried wine, I was 9 years old in church, doing my first communion. And it wasn't explicitly said like alcohol is a representation of, but it kind of was. In my little 9-year-old brain, the first time that I took wine into my body, it was a connection to a higher power. It was part of my culture. It was part of my religion. My little brain in that moment is soaking up a ton of information about my connection to this substance. So if I start to look at these three realms of like, what are the social pieces? What are the psychological factors? What are the biological contributors to why somebody would engage in substance dependence? That's going to give me a very deep understanding of why it would be so hard to change it. Why a mother could grab her son and go, why can't you just stop? Like, you're hurting yourself. You're killing yourself. You're killing me. You're going to get divorced. You're going to get arrested again. You're going to lose your job. And all those things would make perfect sense. But if I have multiple vulnerabilities as a person to why I would continue to do this like self-destructive behavior, it's going to be difficult to change it. even if I am hurting myself, and even if all those things that my mother was saying were true, it's still not going to make it very easy. I'll have the understanding, and my neocortex is going to go, yeah, this is all true. But my impulses and my emotions are going to be driving the boat. And that's what's the difficult part about it. You know, that reward center, when it gets taken over by substance use, that's a hard thing to unravel sometimes, you know?
Yeah.
And we see it. We see it with people all the time. That's why when, you know, I loved how you said in one of your episodes, like, it's a fatal illness. It 100% is. And it's because you're trying to, like, correct a brain that's just not firing correctly, you know?
Damn, we were just talking about the reward system today.
A little, yep.
Yeah. I'll tell you after the pod.
But
Yeah.
that is I did find that interesting though, because you drawn the line to when I was 9 years old. They gave me wine, and I associated the wine with a connection with a higher power. That's crazy. I never even thought about that, like how impressionable like you are at that age. Because then I like try to think about me, and it's like, okay, well, drinking for my family was how you connected with other people, how you made friends, how you got more funny, and all that stuff. And so like whenever I got a little bit older, that was when I got a little bit older, when I turned 12, you know, and I started using
when I grew up,
You were a little older.
just a
I was
little.
a little older.
That's a fact.
You know, it's like that's why I started. So I moved to a new school. I didn't have any friends. It's okay. Well, if they're smoking weed, then I'll smoke weed with them, right? That's how I'll make that friendship or whatever. And then it just became like, okay, well, I really like getting high, you know.
Totally.
But that was cool. I never heard it phrased like that.
Well, and there's a reason why that connection is so impactful, right? So we call it the biological, psychological, social, the BPS, the biopsychosocial for short. That social piece, that social part can be just as strong as the psychological and biological factors combined. And there's reasons for that. When my brain associates social connection and substance use go hand in hand, that's a hard one to break. And the reason for that is, like, you know, over the millennia, and the reason that our species has been able to grow to what it is today is because of social connection, safety in the herd. The more we started working together, the more that our communities grew. You know, when we were able to establish agriculture and we didn't have to chase the herds anymore, and we could sit down in one place and grow our own food, our communities and our numbers just started to exponentially expand. Well, as that's happening, like, that part of my brain that's saying, okay, social connection, empathy, emotions, communication, collaboration, divvying out responsibilities, taking responsibilities, all those parts of my brain are going, this is helping us survive, because it absolutely was. So when my brain goes social and substance use go hand in hand, part of my brain is going, this is helping us survive. And think about that, right? In the depths of addiction, people are going, I just need to do this to get through another moment, to get through another day, to have another hour of quiet, or to be able to do this so I can get up to maybe go show up for my job tomorrow. You know, it's like literally survival mode at that point. You know, so when the brain is sort of being tricked in that way, man, that's tough. That's really, really hard to unravel, because you're trying to tell your brain, no, you don't need this to survive. There are other ways, you know. And that first part, I mean, you guys probably remember what it was like being in early recovery. Remember that first like week or two or 30 days or 60 days?
Yeah.
Like that's a hard stretch, you know, like that's a tough stretch where your brain is like reeling from like going from what it was to what it's trying to be now, you know. And the idea is like, well, can we take that brain that's raw and that's vulnerable and emotional, and the swings and the mental health, and point it back in the direction of what it's designed to do, and that's to connect with people.
Well, it seems like it makes addiction even harder, because yes, like whenever I smoked weed for the first time, it was cool. I was with friends. We went to a girl's house. I hardly remember the night. Like I was plastered from marijuana, you know. But then, of course, as the addiction got worse, I started being around less people, and so like you said, the social aspect of it was now leaving, and so now I was all alone with a very small amount of people who were also doing just as bad things, you know, but at least I wasn't alone, you know. And so I guess it is like the misery loves company. Well, yeah, because I need that social aspect
100%.
in my life, if you're struggling with me or not, whatever. But that seems like it could be even more detrimental whenever someone gets isolated, and we know that that's a big factor, especially during like COVID was super impactful for anybody who was in addiction, couldn't go out, couldn't be around people. My life didn't necessarily change during COVID because I still had a job, I still showed up to work, I was still around a lot of people, I had roommates. But for anyone that is in addiction or alcoholism and all they're doing is staying in their house, staying in their bed, not really getting out, not getting vitamin D, you know, it seems like it could be detrimental.
I mean, it exacerbates everything, right? If I'm already dealing with a level of depression and anxiety, right? And then I start to isolate more. And that is a very common story, right? Where the party, it starts out fun at the beginning. I'm hanging out, it's good. We're going to the bars, we're smoking weed, you know, we're doing some lines on the weekend. It's not a big deal. It's not a problem. And then as the problem escalates, worlds go from being this big, shrinking down to like people using in their cars, people hiding in the closet, you know, people sitting at home for hours and days and weeks at a time, not going out and connecting with anyone. Well, if I'm already dealing with depression and anxiety, that isolation is just like gasoline to the fire. It's breeding ground for not only continuing to numb out because I don't want to feel that isolation, but the isolation then increasingly makes those mental health pieces and satisfaction with myself even worse. You know, it just gets worse and worse and worse. So it's just like a huge domino effect that starts with like the addiction growing and then all of the other side effects just making it worse, you know?
Because that was definitely, well, I feel like it's probably a hard part for anybody, but it was definitely a hard part for me. Like whenever I had gotten sober, the first, like whenever I was in rehab, I felt like it wasn't until like month 3 that I started like really trying to connect with like my peers. And then I left and I went to sober living right in month 4. And then it's like an entirely new people. But then like that was weird though, because I was in Phoenix House, so everybody was close to my age, and I went to sober living, and like the closest guy was 10 years older than me. And so like all I was doing was hiding in my room, you know, because I didn't know how to. Or I guess it felt comfortable to be alone, but it was also terrifying to try and go make friends though, because I just every reason one could come up with, like I didn't think you wanted to hang out with me. But then it was cool, right, for like guys like Tyler and a few of the other young guys from our sober living house that like got sent there, and then like the brotherhood and that we got to form, because then like we fast forward 9 years or almost 10 years, and like we're all still rocking and rolling, hanging out almost every weekend, like still like very close and things, but like a lot of that's just like that connection, that thing that drugs and alcohol kind of took from me, or what they gave me, that I needed to find within the people around me. Because that goes back to like tradition 1, common welfare must come first. Personal recovery depends on AA unity, It's like my recovery depends on us staying together and like making the food and growing spiritually and all that jazz. So,
but it was interesting because in hindsight, 2020, if I look at whenever I smoked weed with what I know now, and I can try and identify like what it really did for me. At first I thought it was, oh wow, I feel great, I'm high. But what it was is it took the lack of, or the worry out. So now I had a lack of worry about this whole social aspect with what people think of me. I didn't care. And, I can still easily get insecure about like how I sound, how I look, and, and all those things. But especially at 13 and 14 and 15 years old, whenever like you're worried, you're worried about the girls. Everyone was taller than me, right? We talked about before this. None of us reached 5'8" in this room. I was super short. I had long hair. I sounded like a girl. I wasn't getting girls. I didn't have a deep voice, like nothing. But when I smoked weed or did drugs, I just simply didn't care about the need for the social aspect, to be met. So, which helped me be alone, because I didn't need to smoke weed. For the first time, I didn't need to be around other people. I could smoke weed by myself. Once I started buying my own drugs, I didn't need to be around other people to get it. I was totally fine with just doing it in my house by myself at 1 a.m. on a school night. I didn't need anybody else. That desire for that connection in that community was gone. And that's what weed did for me and drugs did for me. Similarly, though, I still didn't have people around, and I'm missing that whole part still.
Yeah, like there's so many things that I'm picking up, and I'm trying to parcel it out of my brain because I don't want to sound ridiculous on this, and like start to stay organized. But like the way that you talked about it, it incredibly aligns with like one of like the big values that we hold, and we like to say that the opposite of addiction is connection. It's connection, right? And the cool part about like a big part of our program and what we sort of like the foundation of what we're doing is attachment. And so if we can truly understand somebody, create the space where they can sit back and feel understood, and then point this person in the direction of what's really meaningful in life, and that is the human connection, the quality of relationships, then you're dramatically increasing the chances that somebody might gravitate towards a recovery program. That's, I think, when AA, it's got its pros and cons. The undeniable huge upside of AA is the fellowship. Hands down. Hands down. I think it's beautiful to get a sponsor because you have that individual connection. I think the step work is incredibly effective. To me, it's like recovery in action if you work the steps. But the fact that you can start to generate hope by looking around the room and going like, man, these people get it. Maybe they don't understand every nuance of like my story, but they get it. They understand how hard it is to get sober, and they know how to do it, and they understand in some ways like mental health, and when you feel accepted and a part of in that way, great things can happen. It makes the work, I think, just a little bit easier. And what I try to tell people is I've never seen anybody do it alone. I've never seen somebody come to treatment, decide that they're going to be sober, and then go, okay, I'm just going to go out here and do it by myself.
Yeah.
Because I'm not saying it's impossible. I've just never seen it in my time. And I think it's because like you are literally trying to use the tool, your brain, that's been affected by the disease. So you cannot always rely on your thinking and your perceptions, because there's going to be times when your brain's going to lead you towards something that's healthy and that is towards recovery. And there's going to be times where it wants to go back to what it knows. Yeah. And even that comfort zone, though it may be dark and self-destructive, it's familiar, and that familiarity, like it pulls us back in. I mean, this is one of the reasons why, like, we might see something in a relationship with our parents growing up and go, we'll never do that. And then we find ourselves later in life doing the exact same thing, even though we said and we told ourselves, we'll never do it that way. But it's like, but the observation, right? The modeling of that, like, starts to hardwire things for us. Well, think about how long you guys were using, that stretch of time. It's like your brain got accustomed to like, man, when I didn't want to feel that, marijuana worked.
Right.
I didn't want to numb out. I wanted to numb out. I knew I could easily gravitate toward a substance and I would immediately start to work. So I know later on in life, 10 years down the line, that if I'm feeling something that's really uncomfortable, my brain goes, well, we know what works. We know it works. What about that? Even though it may not make any sense whatsoever to do it. It's just that old wiring that sometimes starts to kick in again.
Yeah. And at least acutely with the, you were talking about needing like this support from a sponsor, from whatever, like trying to do it on your own, at least acutely, is going to be incredibly difficult, coming from the destruction of addiction or alcoholism and then trying to do something different. Like it's almost virtually impossible just to try and do it by yourself. Right. Number one, the majority of the times it's confusing as shit. No one really understands like inventory, like, or a part of the recovery process, or even some of the stuff I'm sure you enlighten patients on or clients on is very new information. So it's like, yeah, how do you get somebody just to come in and try and do it themselves, which usually happens prior to admitting that they need help, prior to admitting into treatment, or admitting they should probably go to a meeting or reach out for help. Usually the resources are exhausted first because we've tried by ourselves so many times.
Yeah, absolutely. Yeah. Well, and I think that's where when people have tried, right, and maybe they're just trying to do what they understand to be the best ways, right? Like I'm gonna make myself a full schedule, right? I'm not gonna have time to use. I'm gonna go to the gym. I'm gonna start to eat healthier, right? Yeah. There's some basic things that I think people try to gravitate towards. Or I'm not gonna hang out with those friends anymore. Okay, and those things could absolutely be part of a recovery lifestyle. But if you're not getting into the deeper nuances of what you're experiencing, if you're not understanding why you're engaging in this behavior, if you're not exploring emotions and getting under your emotions to really tap into like, man, these are the core issues, that the marbles at my center that drive my emotions and reactions to the world, which then drive my behavior, it's really hard to change. Yeah. And it's hard to get there without having a person that you can reflect off of. Like, here's what I think about myself. What do you think? What are you seeing in me? This is one of the huge advantages of therapy, is that you have this objective person that can sit there, that's trained to listen, to be curious, to not put judgment on your circumstances, and to help you find these alternate perspectives of seeing yourself. This is one of the reasons why attachment has been one of the reasons that we've been able to survive. Is not only does it help us work together and collaborate, and safety in numbers. I used to have a director that would say, get in the middle of the herd. If you're on the edges, you're going to get picked off. Well, in the giant scheme of things, get out of addiction. Let's just talk about, humanity. Yeah, it makes sense. Get in the middle of the herd, right? Well, part of that is that as I'm connecting, right, like as we're sitting here and talking, we're sharing knowledge. We're able to see it in different ways, right? Like we're jumping on from subject to subject, and you're adding pieces of information. I'm adding pieces of information. Well, what we're doing right now is we're expanding our knowledge base. We're seeing it from our different perspectives and different ways of viewing it. That is one of the best ways to learn. Well, what if I apply that to myself? What if I can sit in therapy and get curious about why I do the things that I do? And sit back with a person who's not going to judge me for it. It's just going to listen and is going to say, have you thought about it this way? Or I'm seeing a pattern here. I'm so close to the behavior that it's really hard to catch all of that because I'm just living my life trying to figure it all out and stuck with my emotions, my behaviors, and my thinking, my history. When I have somebody that can sit back and reflect that to me and look at it in a different way, maybe I can just expand my knowledge base about myself.
So I actually have a question on that because I feel like I've fallen into the trap of expanding my knowledge base a little too much to where like all I'm finding myself doing is like trying to learn more because I feel like I don't know enough. And so like from the moment this is like my literal experience, from the moment I wake up, I'm like, I need help, because I don't know enough, or like I'm not comfortable with my thought of how I am, my judgment of how I am, because I've gotten into the habit so much of asking for help,
right.
Meaning I can't rely on myself. And that was a thing that I didn't see until like 5-6 years later, when I was like, well, how can I rely on myself? Because I'm constantly expanding my knowledge base, bouncing it off of my sponsor, always needing to keep an eye out, calling my friends in recovery, asking for help, and so much asking for help after so many years, especially going from survival and addiction to survival and recovery, has left me in a place to be confused in recovery, where I'm like, when do I start relying on myself?
Okay. Oof.
Oof.
All right.
Talk to me.
Yeah. Okay. So
Help me, Jacob.
I'm gonna step into something here real quick, but I want you guys to know out of the gate, and I said it earlier, I am a huge fan of 12-step programs. I see what they do for people. I see how much they help. I also see how they can hurt sometimes.
Okay.
This is one of the ways, actually, one of the things that you're citing. So one of the things that I've seen, we can talk about it in terms of a human condition. I'm just going to kind of frame it in the way that we're talking about recovery. Is that sometimes the culture in AA, and this isn't everyone, this isn't every sponsor, this isn't every AA meeting. It's just what I've seen in terms of like what some people deal with going through the process of the 12 steps. Right.
Because your client base is coming from
treatment. We don't force people to get sponsors and work AA programs through Driftwood, but we strongly encourage it. We just want people to pick something. Pick Dharma, go to Smart, go to Celebrate, go to your church group, find your tribe. Find your tribe of people that's going to help point you in the right direction. All right. Okay. One of the things that I've noticed, though, that at times can come out of the AA culture is you can't trust yourself. Like you're selfish and self-centered, like you need somebody to filter a lot of your decisions, especially at the beginning, which kind of makes sense, right? Before you do anything. Okay. Now, I think what ends up happening for some people is they really don't trust themselves. They get to the place where it's like, man, every big decision, I have to talk to my sponsor about it. I have to do this. I have to run it by my whole support system. Okay. But then where do you start having the agency over your own life? Where do you start looking at yourself and going like, I know what I want. I'm values driven. One of the coolest things about working in an AA program is that to me, it highlights like spiritual principles of how do you want to live your life? What are you citing for yourself as important? And yeah, maybe your sponsor might be able to give you some feedback on that, but at the end of the day, it's your life. You should be growing. I don't want to shit on anybody.
Sure.
It would be strongly encouraged for you to find your path and for you to feel, the whole idea of unhooking the trailer of addiction is so that you can move towards a life that has meaning and purpose, and it's hard for me to think that anybody else can tell you what that is.
Right.
Like fostering, one of the biggest downsides of addiction to me is it disconnects you from you. It pulls you away from like your authentic self, from your values, from your principles, from your strengths, from your aspects of character, from you understanding what are the areas of growth that you need to have a better life. Well, when you're sober and you're working towards that, when do you start to trust that you know what you want? So that you're not waking up every morning questioning, like, what am I going to do today? What is my purpose here? Like, should I call my sponsor and ask them that? Like, to me, that fosters like an unhealthy, like codependence and over-reliance on a system that was designed to create agency for you, for you to be grounded in like what you stand for, who you are, and how you want to live your life. You know, so I know that that doesn't happen for everyone, but I have seen that that can be a downside sometimes to fostering an unhealthy codependence where the program is designed to maybe create some independence in terms of what you think and what you feel and how you want to live your life. You know, so I don't know if I explained that right. Like,
I hear that. I hear what both y'all are saying.
Yeah.
I gotta help but be on like a different side of that though.
100%, sure.
Because I did not feel like I got sober and I was working the program of Alcoholics Anonymous because I was afraid of getting high again. You know, like it was like my original sponsor really drove me towards that like hope of a better life.
Totally.
You know, instead of like kind of like that fear. Like base, which I've seen the fear base, like people are gonna like, you're gonna fucking die, you know, if you don't get on this train, you know?
Yeah.
And then like, you know, then you get on the train out of fear, but as soon as the fear goes away, then I might as well quit doing it. Might as well get off the train now, you know? So like trying to pull people with like a vision of hope, right? Rather than this vision of like fear or you know, destruction and such. And, you know, like over the last 9 years, like in the beginning, probably for the first year, everything was getting ran past multiple people.
Sure.
Because I'm like, well, one, I'm like 18. You know, I'm just going.
Need guidance.
You know, I
get it.
I need people to keep me in the box. You
Yeah,
know?
yeah.
But like as I got older, as I gained more confidence within myself, you know, I stopped utilizing like the sponsors so often, or I call my mom whenever I don't know what the hell's going on, but great resource. You know, or like even Tyler, you know, like I find myself calling people a lot less, right, and just trying to make it between me and like my wife, you know, a lot more, because at the end of the day I feel like what matters the most is like what me and my wife decide, because that's our partnership, that's our union. But also like what Spirit's kind of guiding me to do, you know, like recently, like I identified that I had low testosterone, and like, you know, the people were like, well, what about TRT? And it was just something I didn't talk about with anybody, but just something in my spirit was like, I don't feel like being on TRT. But then like other people were like, why the hell didn't you get on TRT? And I'm like, why does it matter to you? You know?
Yeah.
But like, you know, I feel like the independency has to just kind of come from within somebody, and I don't know if that can necessarily be like taught though. I don't know, maybe it can be. But,
yeah, I mean, I kind of think though that like the way that you talked about it is almost like the way that I try to encourage it, right? Because that at that point when you were starting to feel like you could trust yourself more, you know, like I think everybody's on a different growth curve to figure out when and where they're ready for that.
Yeah.
You know, when they're not just running on self-will, you know, and it's really a more of a deeper connection of, no, this is really what I want, right? Not everyone, but I see people really struggle with that sometimes.
Yeah.
You know, of really understanding like, do I have agency in my life? Am I at the point in my recovery where I can trust myself more? You know, and it's not making decisions that are going to derail me off of this path of a recovery lifestyle, you know?
Yeah. Well, I just feel like people overcomplicate, you know, because it's like, okay, well, I can go left or I can go right. What should I do? And it's like, what do you feel like?
What do you
doing?
want to do?
You know, and you're like, I don't know. You know, you're supposed to be the guy to tell me. It's like, well, I'm not the source of power though.
Right.
You know, it's like you got to find that within you and your greater power, your higher power. It's like, I'll let you down. I'll tell you to go right, but you should have really gone left.
Right.
You know. And like trying to redirect people towards like utilizing tools like maybe writing some inventory, or maybe sitting in some prayer and some meditation about it, or even just pausing for a couple of days, you know. Because I know that an issue for me for the first couple of years was just like extreme impulsivity, you know, as you know, Butter can attest to. You know, if I had an idea to go to Corpus Christi right now, you know, and I'm in and I'm going.
We've done it.
We've
We've
done
Done it several times. We almost went
fun.
to Mexico one day, and luckily we talked about how we needed passports, you know, 'cause that would have been an L. But you know, it's been, because a lot of my recovery journey has been a lot more about how I can grow closer to myself as an individual and closer to you know my higher power, right? But also not overcomplicating it, you know, because like, well, how do you know what's the difference between God's will and self will is? It's like, well, I don't know, you know, like the most
We've been
basic.
asking that question for thousands of years, I think. You know?
like the best way I heard it was like God's will is when I do things out of love, and self will is when I do things out of fear.
Okay.
You know, so like if you ask me a question and I'm afraid to be honest with you, so I lie, you know, that would be an action. You know, that would be that self will, right? Yeah. But whenever, you know, I I decide to be honest and practice that principle, right? Then that would be God's will. And that was like the most basic way it was told to me. God's will is when I do things out of love, and self-will is when I do things out of fear. And it was like, okay, cool. I can get down with that. I can get down with that personally. You know, it might not work for somebody else.
Yeah, but that made sense to you.
But it made sense to me, you know, because it just sounded like, well, that sounds basic enough, you know. I'm living in fear.
And it's just not a cookie cutter approach.
No.
Like you can't say what worked for John was going to work for somebody else. You know, at like how long should you expect to do this diligent, intense work before you can rely on yourself? You know, that there's no like do it for 90 days and then maybe try not calling your sponsor, you know, or start relying on yourself, or do it for 2 years or 5 years or 10 years. I think there's way too many factors and variables to consider, from the family upbringing and the genetics and the mental health and how severe you were prior to coming in and what that looks like moving forward. And did you move here from a brand new place or from an old place and this is all brand new to you? Because you can't just say do this for a year and then you'll be fine, because we've seen that and people have stopped. And then you wonder, okay, well, what exactly did you do for a year? You know, and it's just not a cookie cutter, or you can't just have the same expectation per person.
think that's where our field can continue to grow. I think that in our in the field of substance use treatment, that there's a lot of catchy phrases that are thrown around and then they're never very well executed with, like, we individualize care. Well, we should be individualizing care. We should be understanding that every individual is different, and that every individual might need, there's a basic plan here, and then there's some very different aspects that from person to person are going to need to be incorporated to give them the best chance. We know that there are no guarantees. You know, that there are so many factors that would contribute to somebody ending up in a recovery lifestyle and ending up in relapse, you know, or really struggling in their recovery. So, you know, we should be putting it through that lens of what does person A and B and C need that's going to be different, and what are the factors that maybe are some common factors that we can incorporate, you know. And so I think there's a lot of growth there that we can find. And the better the research, the more we understand about the brain, the more we understand about the nuances of this, it'll continue to help us, you know, to be able to be the best helpers that we can be out there.
Well, my question is, like, with just the last, I don't know, what, like 8 to 10 years, I mean, you started having an opioid epidemic. Fentanyl is obviously killing everybody from 13 years old to no age limit, you know. And so over the last 8 years since you've been in the field, going from adolescence to the Arbor to now at Driftwood, like, are y'all altering your program in any way because of what's currently going on? Is there any new research out because of the problem? Like, do people research a specific subject because it's relevant and people are dying, you know, so now it's more relevant?
Right,
like,
raises the concern.
Right, so what's changing over the last 8 years that you've seen?
I mean, what I've seen is, like, I think the neurobiology of addiction is getting better. As our scans have gotten better, as treatment modalities have evolved, as we're starting to understand more of the mental health piece. You know, like we have a good reputation for being a place that can manage the mental health part, right? We just don't zone in on the addiction. We look at, well, what's going on in someone's mental state, the psychological factors, you know. To me, that has been one of the bigger growing parts of the field, is that, I mean, listen, guys, I don't know when was the last time I saw some cookie cutter alcoholic, you know what I mean? Like, that's a rare thing at this point. And I don't think it's just because it's happening now that more mental health has been part of the deal. I think our awareness and our research and our education and our understanding of what mental health really is, and how there's so much overlap between substance use, that we're just able to see it better now and have more curiosity about it and have better tools to have what we kind of reference as like diagnostic clarity. What are we seeing in their substance use and the nuances there, but then what's going on in their mental state that would be factors that would feed addiction, you know, like the meds, the therapy modalities, the personality disorders, you know, the number of different things that people would be able to face in that part, I think, has gotten better, you know, and the more research that we have, the better off we're going to be able to understand how much overlap there is and how strongly tied together mental health is with substance use, you know. So that part, I think, has gotten better. I mentioned the neurobiology piece. Flores wrote a great book, if you want to take a deep dive and nerd out, Addiction as an Attachment Disorder. Because if you look at it on paper, I mean, there are times that people use a substance the way they would have an affair.
Really?
with a person.
Yeah. Okay.
Right? Like if I'm in a marriage and I'm a terrible alcoholic, that's really struggling in my alcoholism, and my wife knows, but then I'm trying to like change that, right? She's saying, you can't do this anymore. And I'm like, okay, I won't. But I don't stop. What do I start doing to get away with it?
Sneaking around.
I start sneaking around. I start lying.
Yeah.
I start creating stories. I start gaslighting. Oh, that's the best strategy there. Make her think she's crazy, about the stuff that I'm doing, right? And then it only feels the guilt and the shame on my part because I'm not living my authentic life, which then only drives my substance use. I mean, let's take out the alcohol and put in an affair with another person. Am I lying? Am I covering it up? Am I gaslighting her? Am I creating guilt and shame? But then they're still getting something out of that relationship. So when Flores wrote Addiction as an Attachment Disorder, he's talking about the way that we attach to people, except we're attaching to the substance, like we're in a relationship. And if you look at it through that lens, I mean, there's a ton of similarities that go through it. So then at the end of the day, we go back to the same thing, right? Well, if we're talking about unraveling this brain from this really unhealthy relationship, this abusive relationship, at times it's incredibly one-sided, a relationship with substance use. Well, then how do we start to heal that brain? Well, we got to start fostering healthy connections. So then that's where, to me, when we start to look at it through an attachment lens, right? Attachment theory being the connection that I have to other people. Understanding my attachment style, understanding, well, what are the tools and the skills that I can start to build on to build healthy intimacy, where I don't have to hide anymore. I don't have to be anyone else. I can just start to be myself and then see if people will accept me and love me for just me being me. Being able to step into my marriage and understand, like, I don't have to hide anything anymore. There's nothing to hide. When I don't have to carry around that weight, does it give me the chance to build healthier, intimate connections?
Yeah, I mean, it seems like a step before that, though, which we should address, is the stigma around mental health. Like, how do you convince somebody that this is totally okay to look at? Because we have generations of, be a man, or whatever, and it's totally limiting.
We should do a whole episode on men and vulnerability. All right, I'm just floating that out there.
Yeah.
That's a whole that's a whole deal there. So we're talking about cultural pieces first, right? Like there's a lot there in terms of like our stigma with mental health and all of that. And it's not like that all over the world, right? We have our own issues here in the United States. I think it's getting better.
Okay.
I think it's getting better. I was in Austin driving around the other day and I saw a billboard that was advertising like a mental health hotline. I didn't see anything like that growing up. I don't even remember having conversations about mental health growing up. I didn't realize till way later in life that I had a family member that was taking an antidepressant. And I remember back then hearing like the little nuances of that conversation and it being like this huge deal that this person wasn't on an antidepressant, a mood stabilizer. And I'm like, wow, well, I come from a very conservative Latino family. So of course we don't go to therapy and get on mental health medications or try to get outside help from like our little family system. We should figure it out on our own, So I think about like the nuances of how it was back then to just me in Texas in this little bubble of my life. How have I seen it grown and improved? I see more advertisements on television for mental health, strictly for mental health, not a pharmaceutical company telling me that if I take this pill I'm going to feel better. That's a whole nother thing. Pharmaceutical companies fund research for the DSM. Does that make that research about mental health diagnosis tainted because we've got the pharmaceutical companies pushing the agenda? If we can label it, then maybe we can make a med for it. If we can make a med for it, maybe we can make more money. I don't love that system for us. I don't like that. John just had a strong move right there. I'm like, what? Wait a minute.
I don't know. I don't pay attention to it enough. Dude.
You know what I mean? It's not great. It's not a great system. It needs a tremendous amount of improvement. However, but then like, for example, like I'm a huge Movember supporter, right? Start on day 1 of November, grow a mustache until you start clean shaving and you only grow the mustache for the month. That started as prostate cancer awareness. They tied it to prostate cancer awareness. Prostate cancer kills just as many men as breast cancer does women. It's our equivalent. Yes, it's our equivalent. What has expanded over the years, and I've been doing it for many, many years, so I've seen how it's grown. They've now expanded it to testicular cancer, to mental health, to suicide prevention. So them having the bigger scope and the more holistic view of, it's not just cancer that's killing our men out here. There's a number of different things. It's suicide, it's mental health. It's like, this is a growing epidemic that we can start to really shift the conversation around, And so all the money that they raise in the month of November, they pour it into programs that are out there helping people. Mm-hmm. Programs like, there was one that was really cool. There's a cool video on YouTube about it, about how they take firemen with PTSD and put them in these like therapeutic intensives to like give them the relief. Firemen, these strong, burly, like lifesavers, they run into these fires, probably have tons of trauma, facts, and then what? Are just made to like sit with it? Oh, here, have a week off. Now come back on shift and let's go do it again.
Yeah.
Like think about years and years of doing that. And we're grateful for our firemen, but we don't take care of them in the way that we should. We don't address their mental health the way that we should. But programs like the ones that Movember funds absolutely are trying to do better about that. So we have a long way to go. I think we're at the beginning of hopefully that shift of being able to pull some of that stigma out of it, man, and just be able to, I look at what we're doing today. Yeah. Like I wouldn't have been able to do this 10 years ago. There wasn't anything like this. I love what you guys are doing. Thank you for letting me support you guys. Getting sober young, like our young people out there need stuff like this. Yeah. They need these outlets to feel like, man, we're not alone out here. There's a lot of young people getting sober, and not just getting sober. That's one thing, but sobriety to me is about also like finding fulfillment and enjoyment in recovery. If you're not going to find that, then why would you stay sober? You might as well go be miserable and use, and have moments and little pockets of relief, Mm-hmm. So I think what you guys are doing is amazing. And to me, like, this is part of the movement of maybe pulling some of that stigma out.
That's the goal, man. That's the goal. How do we make this a little bit more approachable than it's been in the past, Yeah. And then we need great participants like yourself with professional experience. We get people on here with lived experience, people who are in the field trying to help, and trying to destigmatize the avenues that people can take, because I think people know they may need help, which is the first part. Some people don't think so. Some people keep trying until they fail, and ultimately sometimes that failure results in a loss of a life, which is extremely tragic. And one of the main reasons that I like to keep doing this is because I fucking lost a lot of people in my life. If I had to guess, I would say more than my immediate family combined. And it's fucking tragic because people are unaware, of maybe the path that's available to them, or the paths that are available to them, and the resources that are here, because it does start with knowing that there's something, or being curious, and then finding those avenues. And that's why we have this podcast, to be on social media. Like, dude, we're not a resource center. You know what I mean? Right. We get people like, you're the resource. You know what I mean? Which I guess in turn makes us the center. Yeah. But that's our goal, is to shed some light. We have other people that, like, nonprofits in Texas, and people that are like really trying to change some of the laws that are here to address the problem. Whereas with us, we're like, how do we just blow up on social media and make people more aware of what's going on, but also maybe some paths forward. Yeah,
100%. I think any avenue where you can foster some hope. Yeah. Where people are isolated and alone and don't see a way out of it. That sometimes just that one little glimmer, of sitting down and listening to a podcast that can feed a little bit of just like, okay, maybe I can do it. These guys can do it. Maybe I can do it. That's so huge, and once again, that's why I am all in on the Fellowship of AA. I think that is such and not just that, right? But like the young recovery community in Austin, Texas, I'm going to plug our community here, like absolutely unrivaled, and I know that there's good places all over the country, like in California and Florida, but what we have going on here in Austin, I think that's why so many people come to treatment and then come here. Yeah. Because like when you're in your early 20s and you're looking around at most of your friends going to college and, and burning it down, but yet they're still able to meet their responsibilities and they can have fun and, get wasted on the weekends and still show up for life. That creates a very, very difficult obstacle to overcome of like, but why can't I? Yeah. And the thing is, most of the time, hopefully, that people see that when they can't, they can't. And for the 22, 23-year-old that's ending up in treatment, you have to be able to connect to other people your age, or it's just like, it doesn't make it feel like it's worth it. you know, and I don't want to overgeneralize that to people. That's just one of the patterns that I've seen. It's like, if we can help this person, this young person, get connected to other young people that are not just having success in recovery, but enjoying it. They're huge, you know, that are enjoying it. That breeds hope, you know, and when you've got that, man, I see amazing things happen. You know, so I really appreciate what you guys are doing.
Yeah,
for sure.
And it's funny. It's called Getting Sober Young. The part of that is because the problem is now, like, the average age of somebody going into treatment or maybe getting into therapy is now getting younger and younger. So, so yes, technically part of our goal is to shed light on that aspect. The other part is John and I both got sober at the young age of 17. Does that mean that this whole thing is excluded to people who are, you know, got sober before they were a legal adult, could buy a legal drink? Absolutely not. No. You know, this is for everybody, because that guy who's 40 something years old, 50, 60 something years old is going to be able to talk to John and have a really good experience, you know. So we definitely don't discriminate against anybody who's just looking for help. I mean, I feel like you've sponsored some.
I've sponsored some people that have been fairly older than me.
Yeah. I mean, you know, the interesting part about it is that, like, of the few episodes that I listened to, all the themes that you talked about were relevant to, like, anybody at any age trying to get sober. You know, to me, it's just the different nuances that a young person is going to experience versus that 35 to 40-year-old that's married, has kids, you know, has a career, you know, and then is looking at their life going like, okay, I really need to fix this, you know, versus a young person that might go, yeah, it's not great, but, like, do I really need to quit? You know, like, is it really that bad, you know, or am I just doing what all my friends are doing? I'm just getting caught. You know, it's like, that's a fair
getting caught.
fair question. We should talk about that. You know?
Way as well. Oh my goodness.
Yeah.
You know, absolutely. And sometimes it is hard, right? Like, I've never been that person that will sit in therapy with somebody and go, you're going to die. Right. You're going to die if you don't get sober. I'm looking at a 22-year-old and I'm like, you're going to die. If I say that, I better fucking mean it. And I don't mean to cuss, but, like, I don't, you know, I'm not going to scare somebody into sobriety. Yeah. That's not a great strategy, you know? And I'm not saying that if you say it to somebody that you're wrong about that, but I'm also asking you, are you right about that? I don't know. Right. I don't know. Every now and then, I am sitting across from somebody and I'm looking at their labs and I'm like, your liver's dying.
Right.
You're dying.
It will fail.
You're dying. You're in my office. You can barely walk. You're jaundiced. Your liver, you know, lab report is looking awful.
Been there.
You're going to die. Yeah. Like that, I don't have any reservations saying, you know, that's not everybody's story. When I'm sitting with that young person who's trying to figure it out, maybe it's their first time in treatment. They don't have the experience. Maybe they've never had a firm resolution. Right. They've never told themselves, I need to quit. They've never tried. Like, the last thing that I want to do is to ruin a relationship with treatment, with AA, with therapy by trying to scare them into recovery. What I want to do is hopefully foster a deeper connection with them so that they can see, man, there's a way out. If at some point I decide to go out again and it gets bad again, then I know that there's a solution out there. I know that there are meetings and there's therapy and there's treatment that would be 100% on board with helping me get there. And maybe I'm not there today, but I might figure it out somewhere along the way. And then the hope is, like, it doesn't take their life, because there's always risk of that. Yeah. We know how fatal this thing is, you know,
especially accidentally.
Yeah, I was 100%.
I was working with I was working with a 19-year-old, and he was like, you know what, not for me. I'm just gonna be sober. Don't ever want to do it again. Mm-hmm. You know, do fentanyl again. And I talked with him for a while, over, you know, a couple of days, and then, you know, he was like, you know what, don't want to hear from you anymore. And I was like, that's fine. And I was like, best piece of advice I give you: if you find yourself around some fentanyl and you're gonna do it, just take it, cut in half again. You know, because I don't think he's shot up in, like, almost a month, so I know that tolerance is down, and you
dangerous.
Know, it's like you know, that it's sad though that's the best piece of advice, like, I could give to this young guy is, like, if you happen to be around some fentanyl, just do a quarter of what you thought you were gonna do, right? You know,
but at least we're given that advice now.
Harm reduction is what we call that, right?
At least we're given that advice now, because before it was like, you know, no, this, that, how can I convince you to stay here, you know, and then they're just not equipped with maybe some caution if you are going to go back out.
The way that I think about it is that if you can support somebody to not roll the dice too much to put their life at risk, then does that create more opportunity where maybe that recovery path is there for them to find? You know, like, that to me is like, we don't have we don't have the power to dictate that.
Yeah.
All we have is the ability to support, right? And to try and help people see it for themselves. At the end of the day, that's one of the biggest common factors that I see, is that when somebody, the idea of rock bottom is an interesting one for me, because I'm kind of like on the yes and no bandwagon with that. Does somebody need to hit rock bottom? I can tell you that I don't think the answer is yes. I think that somebody could witness somebody hitting rock bottom and go, ooh, maybe I should change. That looks terrible. Maybe I don't want to keep digging, Sometimes it's not necessarily the rock bottom. Maybe sometimes it's the hope, or seeing somebody else that's like, man, they are living their best life and we're the same age. I wonder if I can do that.
Yeah.
There's a positive pull sometimes. It's just as strong as the misery of like the rock bottom. So to me, it's everybody's going to be different in their path to figure it out. My responsibility in all of this is to be open-minded and curious, and to try and understand them in the best way that I can. If somebody walks out of treatment and goes, I'm committed to be sober for 6 months, I'm committed to be sober for a year, I'm like, great. For you, wonderful.
Yeah.
Do it. And then you're going to figure out what this is really all about. Because if you make a 6 month commitment coming out of treatment and you can't do it, you just learned a lot about yourself.
Yeah.
You just learned how difficult this is, how strong the attachment is. I mean, we could sit down in therapy and unravel that for hours just on one relapse, So to me, like, they're acquiring more and more knowledge about themselves as they're trying to figure it out. Why do I want to fight that? Right. Just because I'm scared, that's my shit.
Yeah.
I need to go talk about that in therapy if I'm going to be in this field and live in fear that everybody's going to go out and die.
Yeah.
Because that's not the truth. And I should be connected more to like, what's this person's journey look like? How can I support them? That I have seen is the way that I don't allow my soul to be robbed in all of this, and to be able to like look myself in the eye and go, man, you are actually really helping. This feels effective and it's alignment with what you think is like your value system in all of this,
I got one last question for you.
100%.
Before we let you go, how hard is it working in this field?
Oh man. Try to like describe what I think I experienced with this. Somebody told me very early on that, it's hard for me to talk about this and get emotional. That I was going to get invited to a lot of weddings and a lot of funerals as I started doing this work. And, that has rung true for me. It really has. I've been on both ends of the spectrum. I've seen this disease take out young and old, rich, poor, no discrimination. Doesn't care where you're from, what ethnicity you're from, how rich you are. Doesn't matter, right? So part of my responsibility to myself and to my family is to do what I have to do to take care of myself. Because like, we're in this field because we care. I mean, you guys sponsor guys because you care. Like you want to give what's been given to you and feel like you're making a difference out here. And there are days where sometimes it doesn't feel that way. It doesn't feel like, sometimes I just want to yell, does anybody get sober out here? It's hard, man. But at the end of the day, like, we do get that feedback. I got an email from a guy, a couple days ago that was just like, I hadn't reached out. I'm doing great. Just wanted to let you know, so I know that, we can't save anyone. Let's just start there. We can't save everyone. We know that that's true. But can I do my best?
Yeah.
And sometimes my best has to start with, what am I doing to take care of me? So that I'm not coming into these moments in tough situations and completely falling apart and disintegrating. So not just that, but what about like, how am I showing up with my family? If I'm just going and getting in the trenches with this work day after day, week after week, month after month, is my family getting a shell of a human being when he comes home, because he's so exhausted from like trauma work and talking about people's pains and sorrows and family work and the difficult dynamics of all that. And then I've got nothing left to like come home and give my wife and my kids. Like, that's not okay with me. So it is finding the balance of being able to like give my heart and my passion to this work, because I hope you guys can hear that I'm incredibly passionate about it. But then also being able to like parcel that out to also give my family like the best of me. Like, they deserve it too, and for me, at the end of the day, like, I do this work so that I can show up and be with my family and know that I'm not just contributing outside of my home, but that I'm also coming in and being able to do the same thing. So the balance of that sometimes is the hardest part.
I believe it. I like what you said, man. When I picked up my 9 years and I thought I wasn't going to cry, but before that year of 8 to 9, I lost like 2 very important people. It's super impactful and it hurt a lot. And, you know, it's like the best thing that I can do is try.
Yeah.
You know, without pushing people out. If they want to not be in the rooms, if they want to go get high, if they need help, whatever it may be. And it's like the best thing that I can do is try. I can't make anybody get sober. I can't make anybody better their life, but I can try, you know. And I appreciate your effort to try. I mean, yeah, you're super passionate. You're my fucking therapist for a very specific reason. There's a reason why I keep calling you and keep showing up, because your effort and what you've done to equip yourself with those resources and point people in the right direction to find themselves and be confident in themselves and live that life and become one with themselves either again or for the first time is admirable. So I appreciate you getting on, my man. And we were I know I was very excited about this. I know he's excited about just doing this in general. And so no matter who we have on, but you know, after talking for an hour and 5 minutes, definitely knew we had the right guest today. So
man,
it was tight. It was tight. Thank you very much for being on.
Yeah, no, I appreciate you guys, and once again, man, you guys are out here doing God's work, man. So just keep it up.
Hell yeah,
Appreciate y'all.
that's what we'll do. Appreciate it, Jacob.
Yeah,